which is called Go-Kada, the O-Maxi, and the O-Pay, like that. You should be surprised that some of them are actually paying like Uber on the Okadas. So it's to be able to formalize them, right? An attempt to remove them completely, over 600,000 of them. So that's a huge number. So it's to work with them and see how we formalize. And what will be the formalization is to ensure that they all have their crash helmets, they all have vests for themselves and passengers, and they all have pep talks in which on their cell phones they can get daily traffic update and pep talk update from their system. And at the end of the day, also use their payment solution as a means of settlement once you finish, you end your journey. So it's not that they'll be exchanging cash, on all of those jobs. So all of that is coming up, and we will be using technology as an enabler for that. So what would that do for us? We will know who has caused an accident for us, who is a naughty rider on the road, and who is not compliant. In fact, one of the solutions, you actually can disenable the machine, which you call Okada. You can actually disenable it remotely, meaning that you get a default person, it will not be able to move that machine again. That's the kind of regulation we're trying to bring about. But it also needs for us to speak with them as stakeholders, using unions and all of that, so that there's no backlash. So all of that is ongoing, and we're looking for an enduring, lasting solution. Moving very quickly, apart from the first T, which is traffic management and transportation, is the H, in the teams, which is health and environment. Environment is big. I said we generate huge amount of waste, given that population is very normal, right? So we've come up with what we call a blue box technology. In the last 2 weeks, we're distributing about 6 million. We have another 8 million coming of waste paper bags. Just to get the culture where sorting will need to happen, right? And we keep saying to ourselves that sorting must start from the tenement, from your kitchen, where green bags and purple bags will be for different things, bottles and papers, and also so that collection will be a lot easier, and recycling and reuse will also be a lot easier to be able to do. We're seeing a lot of investment coming up in that area, right? And so we're working with them. And if you go online today, over the weekend we've actually even started cleaning up, the 187 kilometers Atlantic shoreline that we have in Lagos. Lagos is also aboarding the Atlantic shoreline. So all of that is started, to be able to ensure that we not only improve on the huge amount of waste that we generate, that it's actually, there's a backlog in terms of how we collect them and regulate them. But more importantly, how do we convert them to reusable materials? We have huge issues around the PEP, bottles that are not biodegradable. We have what we call the sachet water that are also giving us a lot of concern, right? So it's always a very simple thing to say ban, but when you ban, you're also taking people out of job. So really it's more of collaborating, what are the things we need to say to the producers of these things for them to understand that the things they are bringing out, like what will be their contribution in terms of collection and in terms of reuse. So environment, space is we're doing from waste collection to waste management to also working with a lot of investors on recycling and all sort of things. People come and say that they can convert waste to power, they can convert waste to, yes, I said it's available, come and deploy the technology, they will go and come back, but the opportunities are there, for everybody, given the size of the waste we're collecting, and we're still waiting on people to knock on our doors. Pushing from that is to talk about health. Health, like my colleague rightly said, is very critical to us, right? With over 370 primary health institutions, about 27, 28 secondary health facilities, we need to wrap up, our conversations around health in terms of access, in terms of affordability, and in terms of people also understanding where they need to go for little treatments. A lot of people usually want to go to a secondary health facility because they believe that's where they'll get solutions. But we're saying to people that all the 380 primary health, you need to begin to use them because they are closer to you. They will treat a lot more first respondent in terms of little ailment, even in terms of pregnancy. And so that conversation is going on, and people are becoming a lot more receptive to say that yes, maybe we have to be treated the place with more doctors, with more nurses, but more importantly, what will sit and solve the health issue is the health insurance scheme. which we launched earlier in the year. We have not achieved our numbers in terms of what we believe we should have by the end of this year in terms of registration. We're short by about 1,500,000, you know. But I believe that if we can raise a bit more finance, we can encourage a lot of the poorest of the poor and also even the civil servant to be the first people that will be utilizing the health insurance scheme. We believe that in the next 4 years, we can register about 3.5 to 4 million people. Right now, we're doing less than 500,000, right? But we just started this year, right? So even with the support of the National Health Insurance Scheme, right, there are some intervention funds where we're asking people to help us with, so that we're doing a lot of advocacy, we're doing a lot of information and sensitization all around, and we're trying to be able to determine where the poorest of the poor, who truly really would not be able to. How much are we talking about? For a family of 6, 4, and the parents, we're talking of less than $150, right, to cover basic, you know, health coverage, right? So it might look small, but a lot of people can still not even afford it. So we need to be able to creatively look for finance to be able to support people so that health will become accessible. Some of those infrastructures are there, but people just don't go there. So it becomes accessible and a bit of affordable, right? So all of that mix is happening, and we're trying to push the envelopes. Because when we push that, we can now engage about the 2,000 private health hospitals that are also available in Lagos. At least when we get 1,000 of them joining us. Because why are they not joining? Because of their capitation. They would expect that once they treat, there is no debt finance, so there is no what we call a funding that they can go and pick their checks. So once we fund the health insurance, the private health institutions will join, and you have a lot more access. You don't need to travel 7 or 6 kilometers to get to the very next health facility that you can access. So all of that is going on in terms of the modalities, in terms of how we can formalize and engage ourselves. So those initiatives are pushing. On the E of the themes is education and technology. Education and technology it's a big one for us. I will confess and say that my brother Gio that left, there's something that has worked for them, or that is currently working for them in Edo, which is the early education initiative, and which, you know, what is working you really can copy, you know, and we've seen it that with the technology they're using, we also can wrap up with it. So we've finalized the discussion, right? We've gotten about 1,000 primary schools in Lagos, but we'll have about 18,000 private primary schools. So we'll have about 1,000 public primary schools, but we'll have about 18,000 private primary schools, right? So, but we also know that out of that 18,000 of them, right, a lot of them, about 40-45% of them are actually sub-optimal. They're not at the quality in which we would expect. But it's because of the gap that they saw in that system that they're taking their kids to the private school. So we're taking the initiative back to our public primary schools, and we're starting with about 300 of them between now and January. So what do we mean? I mean, we're retraining all the teachers, we're giving them tools to ensure that they are not just in class, they're also teaching, you know, so the lesson note and all the curriculum they are meant to, it's all digitalized and they all can take it, you know, so every child is being thought about the same thing, you know, on a week-on-week basis, and you can monitor remotely. You can actually see the progress of what is happening. With that scheme, we